Welcome to the MedScope podcast, where we explore fascinating careers in the medical field and the incredible professionals behind them. Today, we're diving into a field that not many people think about, pediatrics, but with a unique twist. We have a very special guest, Dr. Ceyda Sablak, a military pediatrician who not only cares for children, but also serves our country.
Being a pediatrician is already a demanding job, but working in the military adds a unique set of challenges and responsibilities. In this episode, we'll dive into what it's like to care for the children in the military setting, the challenges and the rewarding aspects of being able to have this career, and advice for those interested in military medicine and just this podcast in general.
Dr. Sablak, welcome to MedScope.
Thank you for the warm introduction, guys.
Of course.
Okay, I'm gonna be starting off with a very simple general question. We wanted to know what inspired you to become a doctor, and why did you pick the military pediatrics and specifically?
Yeah, that's it's a question that has so many answers because everything kind of leads up to that point in your life. So when I was a kid, my mom, when she was giving birth to my brother, had a lot of difficulty finding a woman OBGYN. And that really inspired me a lot to want to become a doctor. So I thought I was going to become an OBGYN for a really long time. Um, and then as I kind of worked with kids like through mentorship programs, and then between college and medical school, I worked at a group home. I became more interested in like pediatrics and then especially like pediatric psychiatry. When I got into medical school, I realized I didn't like psychiatry. And I really liked procedures. I liked high acuity, so people who had like complex medical issues. And I was between pediatrics and emergency medicine, and I ended up going into pediatrics. Regarding military medicine, I was always interested in the sense that we had recruiters come to our undergraduate school or undergraduate college several times a year, and every time they came, I would talk to them, ask them questions. I like the idea about being able to travel, discover different parts of the world, helping a unique community. Because I was thinking about psychiatry at that time too, so I thought like PTSD and this population would be really interesting. So there was a lot of factors that went into all those decisions. Yeah.
Did you always know that you wanted to serve in the military, or was that a decision you made later?
It was something that I was always thinking about, but really when I became sure was my brother, who's younger than me, he was pretty sure that he wanted to be in the military, and he was like, wouldn't it be cool if you're both in the military together? So even though I'm like 8 years older than him, he was kind of the deciding factor, knowing that I wouldn't be in it alone, because obviously it will probably get into it like as a visibly Muslim woman with a hijab. I did have concerns, but I haven't had any issues in the military, and I'm pretty proud to be serving my country in this way. It's pretty special, and I get to work with, active duty members, service members, kids.
Mhm.
What was your daily life like during residency, and how did it change to up to now?
Yeah. So I'm still in residency. I'm in my last year. So residency is a little bit different because it's protected time. So you don't have a lot of requirements when it comes to the military. So during our intern year, we had like a 10-day camp basically where we were sleeping in little cabins and we went out and did field training. And that's basically the field training that we do is like we pretend it's like a war zone. There's all these simulation like dummies that are kind of laid out that might have like amputations or that are kind of calling out for help. There's like all this sound and smoke in the background that is kind of simulating that like war environment. And you're supposed to go out and kind of medically evacuate these dummies. So that's kind of one of the main things that we did related to the military. Other than that, we are also going to have like Army war training before we graduate. So that's in a few months. But that's also similar where we kind of practice, how to shoot a gun again and like how, the different formations that we're supposed to go into and things like that. But really, from like beginning to the end of residency, what they want you to focus on is really your residency itself. But since military medicine is pretty unique, I got to have the experience of like they call it a TDY, where it's like your duty station changes where you work in a different location. So I applied to go to Alaska for a month during my residency and work in the clinic there, which was a really unique experience that you wouldn't get in a lot of other residency programs. And then we also have a lot of opportunities to do like medical transports that I think you wouldn't get to do in other residency programs as well. So I didn't get to do, I got to do one from like an ambulance transportation, but I have a lot of friends in our residency program who got to do CCAT transportation. So what that is like a huge army plane, and they flew from like Hawaii to Okinawa with like a NICU patient, so like an ICU level patient who's like intubated and has all this like respiratory support, and they're kind of transporting this huge military plane and either, bring the patient from, Japan to here, from here to California, things like that, and transport them to the place they need to go. Yeah.
Oh, that sounds so fun.
It is.
It's very
Like
unique.
so much, it's so much different than I feel like a regular like residency that like I guess there's more like movement in a way too, because like there's also the training part. So
Mhm.
I had no idea this was like the part of like the experience.
Yeah, and I feel like not many people know about it either. I've
Yeah, I think so too. I think it's kind of not necessarily overlooked, but not a lot of people do it, so it's hard to know what exactly it's like.
hmm Since you prepare a lot and you have like like a totally different path from like the traditional kind of way, like what challenges did you face?
Yeah, so for me, staying physically fit is always a challenge because in residency, like you're already working so many hours a week, like 80 hours a week, right? And they're always talking about like wellness, get your sleep, and like, make sure you're working out. But in a civilian residency, there's really no consequences to that if you don't do it, other than like your own personal like wellness, obviously. But in the military, like twice a year, we have to take the ACFT, which is like the Army Combat Fitness Test. It's like six exercises or like events that we have to do. It's like push-ups, you have to like deadlift like 150 pounds, you have to do a sprint drag carry where you're like carrying 150-pound like weight and then like carrying these like 25-pound kettlebells and like all this crazy stuff. And then you finish with a 2-mile run. So we do that twice a year. So anytime it's like ACFD season's coming up, I'm always like stressed out. I'm like, I have to start working out, I have to be healthy. So I think that's like the hardest hardship for me, which seems kind of like basic for some people, I guess. Not very cool, but honestly, that is the hardest part for me.
Going off of that, I mean, I would assume that because it's like more military based, like what was it more like male dominated, like your residency as well? Is it more like male dominated or like is there like balance between like male and women in the
Yeah,
field?
that's a really good question. In our residency program is pretty balanced. I think pediatrics usually is. And I think the military is getting more and more balanced as well when it comes to male-female ratios, as well as like when it comes to religion or ethnicities as well. I think it's a lot more reflective of other institutions. Yeah.
Mhm. So you work with children in the military families. So how is pediatric care in military setting different from like a civilian hospital or like clinics?
Yeah. I think we have a lot more continuity or like personal relationships with our patients. Um, Not that that doesn't happen in civilian institutions, but I think civilian institutions can become overwhelmed with a lot of patients, so it can be difficult to have that continuity. Whereas in the military population, it's a smaller population, so everyone kind of knows everybody. Um, And then at the same time, it's like if you have a patient in clinic and you end up admitting them to the hospital, to the pediatric ward or the pediatric ICU for something, you kind of continue to follow that patient. In residency, that's less so because you're on different rotations. But once you start working at your first like duty station outside of residency, that's kind of what it's like. There's 3 or 4 doctors. You have an empanelment and like patients who are impaneled to you, who you are always seeing. And if, you see them in clinic and they end up needing more care and you end up admitting them, you're still kind of following them on that inpatient side as well.
Are there like I don't know if like you've seen it so far during your residency or not, but was there like specific like health concerns that like children in the like from the military families face, like that would not be like common in like normal like setting in a way?
Yeah. So I think they have more because military families are moving every like 2 to 3 years. I think there's more like mental health concerns when it comes to the military child. So for example, like April is the month of it's called the month of the military child where they try and do like advocacy for kids who are dependents of active duty members and kind of shed light on the sacrifices that these kids are also making. Like moving every 3 years is a really hard thing to do. Every time you have to make new friends, you have to, adjust to a new school, adjust to a new place, environment. So I think recognizing those needs and, being aware of that is the main thing. Yeah.
Do you work with like psychologists or like other specialists to support these children?
Yeah, so we have like family advocacy program, which kind of helps with all of these situations. In our clinic, we also have something called like a healthy steps specialist, who's like a social worker or like licensed psychologist, who, if you have any like day-to-day questions in the clinic or you need resources, she's kind of always available there for you. And will come in and talk to the families right on the spot, which I think is a lot different from civilian institutions where it can be so hard to get that mental health help right away in a lot of situations. So we do have a lot of resources here at the they're called military training facilities, so like those larger military facilities. Unfortunately, when we go out to smaller facilities, those resources may probably don't exist. I'm going to say may not exist and be nice, but from my understanding, a lot harder. But kind of in these big institutions, at least, we do have those resources available, which is really nice.
Thank you for that answer again. That's like
Ah,
very interesting to know too for us as well. I had no idea these like I did know it existed, but I didn't know it was like this common. Like, I didn't know they had to move like 2 to 3 years, every 2 to 3 years and stuff. So it's like
yeah,
nice to
it's
and
tough.
like sorry, were you saying something?
Oh, I was just saying it's tough. Yeah, moving every 2 to 3 years. Yeah.
Going off of that, like from like your undergrad years to med school to now like residency, like was there a significant moment where like I guess like that challenged you or like where you just like physically or like mentally like felt like I don't know, like it put like difficulty on you as a person? Like I don't know, like maybe like a patient or like something a class that you took during your like
Yeah.
med school years or stuff.
Yeah, so I actually had to repeat my first year of medical school. I failed my classes. That was a really hard time for me. Yeah.
Was
I,
there like a specific reason or like
not anything specific other than medical school is hard and it was a lot of information at once. And I think probably as a student who had done well up until that point, all of a sudden now I wasn't doing well and I didn't know how to do better. I was like everything that like used before isn't working. So what am I supposed to do to be like better, basically. But I was really lucky. We had an academic support center at our medical school. And the person who helped me there, Dr. O'Callahan, I still chat with her like to this day. I'll like update her on my life and stuff. And it was tough. That first year of like medical school was really tough having to do it again. But I think I was pretty open about the fact that I had to do it. And I ended up meeting a lot of people who actually had to repeat that first year as well. We ended up like creating something called the Breakfast Club. So after every exam, we'd go out and have like brunch together and just talk about everything except the exam and like how we were doing, how things were going. And that group actually continued to grow. So I think like the first year we had like 4 or 5 people in the group. And when we became second years, like people ended up having to fall back from second year. Like they had to either take academic leave of absence because of personal reasons or because something in their studying wasn't working, so they ended up failing a class. And that group just kind of kept getting bigger. I think by the end of the year, we had close to 10 people. So, or by the end of my graduation. So it's really like you're not alone, you make it through eventually, and it doesn't really have a bearing on the kind of doctor you're going to be in the long run. But I think getting there was like being able to say that now, like I'm at the end of my residency, going out to practice soon, hopefully. It's easy to say now, but like going through it, even when I was starting residency, I was like, I'm going to be behind everyone because this happened my first year of medical school. Even though I made it through medical school, I passed everything. I didn't have any issues again afterwards, but it's like that imposter syndrome definitely is like a big thing to overcome.
Well, I'm pretty sure like you see like very interesting cases maybe. Like was there one like that you couldn't forget that like stuck out to you? Like a very like challenging one maybe?
Yeah, so a really tough case that we had was in the ICU here. We've had a lot of tough cases actually. Um, there's a really long-winded one. I guess I'll go with that one instead. I recently talked about him as well, but he was a autistic kiddo who had sinusitis, who ended up developing seizures and presented to the emergency department in like having seizures. And then he was found to have an empyema, which is like an infection of his brain. So they had to do like a surgery to remove that like infection from his brain. And then he was on a really long course of antibiotics, IV antibiotics. And then when you're on that long course of IV antibiotics, you can have side effects for that. So then he developed something called DRESS syndrome, which we caught a little bit later than maybe if he was not dark skinned. So he was an African American kiddo. So it was harder to kind of see that rash. He had come to the emergency department a couple of times and we had thought it was maybe just allergic. His labs were looking normal. So we had DRESS syndrome on the differential, but we weren't like 100% thinking it was that. Eventually we did diagnose him with the DRESS syndrome. Then he went on, he had to follow like gastroenterology and the nephrology, like the kidney doctors, because DRESS syndrome kind of starts deteriorating the rest of your organs. It's pretty terrible. And then eventually he did get better. He lit up the Christmas tree, but it was like this whole like over the course of like a year and a half, I would say, like all of the residents knew who this patient was. Everyone was so familiar with him. And I saw him across multiple rotations. I saw him in inpatient settings. I saw him in outpatient settings. So it was a really special experience and I'm glad it had a good outcome. So.
I don't know if this is gonna be like I don't want it to be sound like too personal, but I want to know like because I mean like being a doctor in general, it's like it has a lot of like emotional side to it. Like you could like bond with the patients and stuff. Like so far, like during your residency, was there like a case where like you like I guess like had a bond or like it was just like emotionally like hard for you to like take care of someone or like was there like a significant moment like that?
Yeah, I think I try to bond with like all of my patients. A significant one, I don't think there is one that sticks out significantly, just because I don't know what the reason is. I think it's because I really do try and bond with them all equally. Um, but I don't have a specific one, but I think there are moments where it was like hard to detach in that moment, or where in that moment you have to compartmentalize because you have to provide the best care to a patient. But then when you pull back, you realize how emotionally difficult that was. Like I have cried with parents before and I have like shared those emotions before. I've like hugged patients and patients' families before. Those are all like not professionals, like not professional, right? Like we're not supposed to do those things. But when you're in that moment, it at the end of the day, it's humanity. Like, you understand, like, the patient kind of looks at you, or the family looks at you, or they ask you, you know, can I give you a hug? And then it happens, and that's okay. I was going somewhere with this. I'm trying to remember what I was going to say. Oh, compartmentalizing. So in that moment, you compartmentalize because you have to provide the best care. But then when you step back, you have to talk with your residents. You have to talk with the other attendings. You have to make sure the people around you are okay too, the nurses as well. Just making sure everyone's on the same team, like recognizing what just happened in there was very difficult. Like, how are we all feeling? How do we need to process this? What do we need to do? And for like patients that do pass away, we'll do like walks of honor. We'll have like kind of therapy sessions afterwards to make sure everyone's feeling okay. But I'm really lucky to be in a residency program that has a good culture surrounding like recognizing like emotional intelligence and how to approach
Like
those sorts of
therapy
things.
sessions for the doctors?
Yeah.
Oh, does that like help at all? Like, have you seen it work?
Yeah, I think so. I think it's really important to have someone to talk to. I had a therapist like that I started seeing during medical school actually, and I continue to see her. But like residency programs are required to provide you with mental health support as well. So it's like an ACGME requirement.
Mhm. Well, taking a little bit of a break from the sad part of it, I want to go
Yeah.
to more positive parts.
Yeah.
So on the other hand of like all of this like experiences, like what was like the most rewarding moment you had? Like during your residency or like how like in work with your patients, with your cases?
Yeah. I think the most rewarding moments are when, like, you can see it in a family or in a patient where it's like you help them. Like, sometimes not every moment is that satisfying because, like, doctors don't have a superpower to cure patients. Like, that's just not the reality. It doesn't happen every time. Like, they come in asking for help, you do the best you can, they recognize you're doing the best you can, but they still leave with pain or they still leave with those symptoms and you can't help them. But whenever you see that, like, they actually like felt something change, that they're feeling better, I think like those moments are what motivate you to get through kind of those harder times where it's really tough. You can kind of pull back on a moment where it's like, this time I had really helped a patient, like it really made a difference in their lives and it's going to be okay in the end.
This is like going like way back. I forgot to ask this like
Oh yeah,
before.
it's okay.
I wanted to know like where you went for undergrad and med school, and like was it like difficult? Like I know you said med school like first year was like difficult like class wise. Was there like a significant change from your undergrad to med school, and then like was there like a change in the med school to like residency too?
I think so. I went to Elizabethtown College in Pennsylvania, and then I went to University of South Florida in Tampa. And then I'm doing my residency at Tripler Army Medical Center in Hawaii. So between college and medical school, I think there was a big difference in the volume of information that we were expected to learn and process and like memorize. But I think for me, I had also had a break between college and medical school. I did a gap year of 2 years. But I think I was also a little bit removed from studying for a while and what that meant. So I think that was part of the reason why I had difficulty when I started medical school. Um, I think there was a big difference regardless. Like whether or not I took those 2 years, I think I still would have struggled and I would have been more burnt out. So I think it was all for the best, to be 100% honest. Between medical school and residency, it's easier in the sense that you're not taking exams every like 2 weeks anymore. So it's a lot easier in that way. But it's harder because of the hours, and you're now expected to kind of manage studying for your board exam while working, and there isn't really anyone who's making sure that you're doing that studying. So you kind of have to be really on top of your own self to make sure that it's happening. But I'm one of those people who would argue that residency is easier than medical school, for sure. For me, medical school was the hardest. For me, getting into medical school was the hardest. And then medical school was like the second hardest.
When you were taking the MCAT, like was it just like hard to like be able to study or like focus? I guess like because like it is like really hard to like just get into medical school, but like also like finding the motivation to be able to even like start studying and being able to study consistently must be like hard too. Like even in high school, like as high schoolers, we struggle with that. So like I don't even want to imagine like how it is for like the MCAT.
And like, did you do
Yeah.
anything else like other than like your classmates, like something different from what everybody else does that like helped you maybe?
No, I think for the MCAT, the best way to study is just do a bunch of practice questions, take a bunch of practice tests. And once I started doing that, my scores started going up. It's really about like exposure. And then I think I was like in my head a lot too. I think part of it is exactly what Beza said, like just um the finding the motivation to study and like stick to a routine. That's really hard to do. But I think part of it is also just the test itself, being comfortable with the test and knowing that a lot of it is mind games and like trying to stay focused and just take your best stab at it and move on to the next question, because sometimes around that next or like 10 questions ahead and you're thinking about the question from 10 questions before it, it's like you're not focusing on the question in front of you. So yeah.
Thank you for that.
Yeah, I hate standardized tests. I'm so glad to be done with my board exam, hopefully in October, and then never have to take a standardized test ever again.
Okay, so going back to like your career and what you want to do, like what keeps you motivated to continue this work and your job?
Yeah. I mean, I love seeing kids. I think going into work and like hanging out with kids is the best thing. Like right now I'm on a rotation with family medicine and I keep seeing adults right now just for a month because I'm trying to learn sports medicine, and I'm like I made the right choice with pediatrics. They're just so cute. Even when they're sick, like they're not like complaining for the most part. Sometimes obviously like if they're actually in a lot of pain, they are crying and they're very fussy, but they're just like honest, like little balls of innocence. I love spending time with them. They're very cute.
Oh, wait, sorry. I just like zoned out. I guess like to like wrap up like the questions, like the main question part, like you said like you really like your job, but like if you like could go back in time, maybe would you
Mhm.
still do this, or like maybe like you would want to like choose like something else? I don't know.
I think I would still do this. At a different point in my life, I might have said something different. Like in medical school, if you asked me, I would have been like, no, pick anything else. Do something else. But I think now at the end of the finish line, like, yes, 100%. I think everything worked out exactly how it was supposed to. And I think I'm really lucky with how everything worked out for me personally. And like it's important to remember to be like grateful for that. Because not it doesn't work out as smoothly for everyone else. Not that like my path was smooth, but like at the end it all like worked out type of thing. Like it doesn't always work out for everyone in the end. It's important to like remember that, or that it's not the end yet. Yeah, like that's also like the other perspective of that. So anyways.
So for anyone watching or like listening to this and wants to become like a military pediatrician, what advice would you give? Or like, is there any qualities, like kind of like things that they should have before going into this job?
Yeah. I think being in the military requires you to have a lot more flexibility than if you were to choose like civilian medicine for sure. Like, because you're still moving every, 3 to 4 years. If you end up getting married, you have kids, you want them to be like resilient and flexible in the same way. So, like, being flexible, being adaptable, kind of making the best of what's presented to you, because the military has a lot of different opportunities, and sometimes those opportunities might not be what you want to do, but there's still opportunities. So recognizing the good in those and just kind of pushing forward, making the best of what's been given to you, I think is especially important if you're considering military. Yeah.
Thank you for all of your answers. They're like all amazing. Before we like go to the closing, we want to do like a quick like rapid like round where like you answer like the questions like in a like I don't know, a few words or like max like 2 sentences.
Okay.
And then we just want you to say the first thing that comes into your mind, like completely honest.
Okay.
Okay, so first question, what's your favorite part of being a pediatrician?
I love making kids laugh and giggle, giving them like stickers. Yeah, it's my favorite part.
One thing you wish people knew about military doctors.
Hmm. I think it's the fact that they have to do a lot of extra stuff that civilian doctors aren't necessarily doing. Yeah. Whether that be like the ACST or moving every 3 years. So, yeah.
Do the push-ups include in that? Like
Yeah,
you
there
have
are push-ups in the ACFT, 100%.
most interesting place you've been stationed at.
Ooh, well, I haven't been to a lot of different places, but I did really like Alaska for sure when I was there for a month. And then I'm going to South Korea next. And I'm in Hawaii. I feel like every place I've been to has been pretty interesting so far.
Yeah, it's like you were like moving around to they're all in like different places too.
Yeah, I'm
Uh,
very lucky. Not everyone get like that's what I was trying to say. Not everyone has the same path, but I've been very lucky. Yeah.
So do you move by yourself or do you have like roommates that you stay with?
I have a husband, so I'll be moving with him to South Korea. Yeah.
That's interesting. Okay, so next question. What's one medical myth you wish would disappear?
Ooh, vaccines are causing autism. And that they're toxic and they have like heavy lead poisoning and heavy metals in them. That's my least fate. That's the biggest medical myth that needs to disappear.
okay, last question. What's like a hobby or activity you like enjoy doing like outside of like medicine, like anything medically related? Like
Lots of things. I love hiking. I love like water stuff, kayaking. I'm really bad at it, paddleboarding. Just being out in nature, camping. I like outdoor stuff. And I play violin. So those are my activities.
Okay, so
do you
that
have
last question.
wait, sorry. Last question. Like, this is what I'm just curious about. Like, when do you like you list so many activities like during or like during medical school or like during your residency, like when did you have time to do most of these? Because usually
Any
like
Yeah,
they like
anytime I have time off, and for me, it's about scheduling. Like sometimes people, my husband especially, he's like very type B. He's not in medicine, so he'll look at my schedule. He's like, "What is this?" And it's like every day, every hour is like scheduled out. But that's how I make it happen. That's how I have time for stuff. Sometimes it is important to also relax like him. I agree. Sometimes don't have stuff in the schedule, but that is how I kind of made it work. When your schedule's like very tight, it's like recognizing, okay, this is the one day or the one half day that I have off. How do I want to utilize it? And it's like maybe a month in advance, I'm making that plan. Like, March 27th on whatever day I'm gonna go and do this hike. It's already on my calendar and it's happening.
so like planning ahead is like the most important part. Yeah.
Yeah, 100%.
Do you study a day or like do you study right now in residency?
I study, but definitely not like I did in medical school, not like I did in college, probably not like I did in high school even. It's more like as it comes type of thing. So right now I'm studying more than I did my first 2 years, and that's just because my board exam is coming up in October. But really, the first year of residency, it's about like figuring everything out, figuring the hospital out. Maybe if you're doing a couple practice questions here and there, reading a couple articles here and there, that's great. But it's really about trying to like figure out how to be a doctor. And then kind of as you progress through medical school or through residency, you're adding maybe more practice questions. Maybe you're starting to read up on different stuff that could come up on your board exams. But really, I'm not studying that much anymore, thankfully. It will ramp up though. I know my board exam's in October, so probably like the month or two before it, I'll be studying like every day for a few hours. Yeah.
Is the board exam, is it like pass or fail, or is there like a certain score that you need to get?
Yeah, I think it's pass or fail. It depends on each residency. So probably Some of them it's just pass or fail. Some of them they give you a score, and if it's like above a certain score, it's pass or fail. I'm sure the score itself doesn't matter so much.
I see. Okay, thank you so much for informing us about all of these. We as the host learned so much as well. And this has been just such an insightful conversation. And thank you for sharing your experiences and giving us a into the world of the military side of medicine. And before we go, is there anything else you'd like to share, maybe a final message to our listeners?
Well, I think this is a great program. First of all, I'm glad you guys are doing it, and you're getting such good exposure as high school students already to different military careers. I think my one advice is always start with Bismillah. I think that kind of changed my life and attitude when I was studying for the MCAT, when I was trying to figure out am I going to get into medical school? I would just try to start each day with Bismillah. When I sat at my desk, pulled my chair out, sat down, just renewing my intention. Why am I doing this? Why does this matter to me? Why do I want to become a doctor? Because that's what Bismillah means. Yeah, it's about intention. Why am I doing this? So I would just say that's my one piece of advice, and everything will work out.
That was such a good message to end up on. So thank you again for your service and for being with us today. And to our listeners, if you enjoyed this episode, make sure to subscribe, leave a review, and share it with anyone interested in military medicine. Stay tuned for our more inspiring stories from the medical field. And until next time, take care.